Hey guys, I am getting ready. Just got some relaxing medications put into my IV. So everything is good. I have an amazing nurse. Her name's Lizzie. I woke up a few hours ago. It is now 9:45. When I woke up, I don't even remember what I said. I am in the hospital still. I had to stay overnight, so didn't get much sleep last night though because my pain increased. Hi, I just arrived in Atlanta, Georgia. My sister is accompanying me on this trip. I'm very, very tired. We were both very tired and very hungry. Our flight left at, well, we had to get up. I got up at 4 a.m. We had to leave our house by 4:45. We got to the airport by 6. Then our flight left at 8:05. So we're very tired, but we just got to the rental car and we're gonna eat and it's a very cute place. Okay, so I just got out of the pre-op appointment with my surgeon. I never met him in person before, but I've obviously heard very great things about him, and his office has been wonderful, and it was really, really amazing. I wasn't expecting the overload of information, but in a good way. There's just so much they go over and prepare you, and they make you feel so comfortable and good. Yeah, I just feel really ready for surgery. He went over every single thing that he's going to do. You know, it's Excision, but there's a lot to it. So, yeah. I'm actually going to go get COVID tested right now because obviously I have to get COVID tested, and I've never been COVID tested before. I don't have any symptoms or anything, but I'm just really nervous and I'm so scared because I'm just so afraid it's gonna be painful. He keeps making fun of me. She's like, yeah, it is painful. Like, it was so painful that I had to pull my head back, and I don't do that. I'm usually a really good patient, so, and I was like, okay, geez. Hi everyone, it is day 2. We haven't done much today. I haven't done that much today. I did some work and schoolwork, and for the rest of the day, we're not doing much. Today was my rest day. Tomorrow I'll be starting my bowel prep and taking all the medications that I need to before surgery, and then Friday is surgery day, so if anything interesting happens, I will pick the camera back up and show you. Alright everybody, it is day 3. It is bowel prep day. So fun. It's actually about 2 o'clock right now. Surgery is scheduled for tomorrow. I'm not allowed to eat anything today. I had a light breakfast, but that was about it. What else? We've been kind of bored. I mean, we've been keeping our days as busy as we can, but I had some work and homework to do anyway, so there wasn't really much to document in between. But now that I'm starting my antibiotics and all my bowel prep today, things are getting real, so really real. Probably not gonna feel too well today, but I will definitely pick up the camera on the way to the hospital tomorrow, hopefully a little bit inside, and we'll see where that goes. But I can't wait to look back on this and remember how painful it was and how difficult it was, but how fast it went by, you know?
And how far you've come in your health for your future.
Ooh, yeah, actually, this is probably a good time to go over this while I can still talk. Okay, so if you are really serious about taking care of endometriosis and you want to find the top specialist, excision specialist, whatever you're concerned about, I'm mainly concerned about my, well, I would say fertility, number 1, and then number 2 is my symptoms. it's really important to do your research on, you know, the doctor itself. There's a lot that goes into it. Put it this way, my doctor even does so much during surgery to prevent scar tissue and pelvic adhesions post-surgery, because that's kind of inevitable. Anytime you do any sort of work on anything, if you get a cut outside of your body, you scab, it's the same thing inside of your body. So what's really interesting is my surgeon does what is called platelet-rich plasma, and I'm going to read this so that I don't screw it up. Platelet-rich plasma helps jumpstart the healing process because it is a concentration of your own autologous platelets, which have reservoirs filled with powerful growth factors and healing agents. To get the PRP, we obtain a small amount of your blood, then separate and concentrate the platelets. Your surgeon then applies the concentration of platelets to your wound, surgical site, or injury site. So my surgeon is literally going to be taking all that and putting it all over my pelvic region after he's done with the surgery, because that jumpstarts the healing process, which is really, really important. I wanted to share that with you guys because so much goes into this surgery. It's not only just removing the endometriosis, it's how they do it. Of course, you've heard me in other videos. It's really important to get excision and not ablation. Their method to doing it. So my surgeon doesn't prescribe any hormonal therapies. Before, in his words, it actually is not good to take a hormonal therapy before surgery because it can mask the endometriosis inside your body, making it harder to see during surgery. And of course, you know, his technique and everything he does inside. I have a right ovarian cyst that he's going to be excising out. It's called a cystectomy or whatever. And then he's going to be clearing out my fallopian tubes if needed, putting dye down them, making sure nothing's blocking. So a lot of his procedures and what he does inside and his technique is really to sustain your fertility, number one, but number two, that'll automatically, you know, help your symptoms that we experience with endometriosis. So it's really just a win-win all around. Okay, real quickly, I want to show you guys what I'm bringing to the hospital. So I brought a backpack so that I can carry everything that I need in the hospital and for after surgery. I brought some fuzzy socks, or I'm bringing some fuzzy socks, a sports bra, a bag with a hair tie, scrunchie, and ibuprofen and Tylenol. Cough drops for afterwards, because your throat will hurt. These pants, just in case, they're like really soft joggers and the waist is really loose, so I don't have to worry about it irritating my incisions or anything. In here, I packed some pads, underwear, activated charcoal. I'm not sure if it works that well, but I'm bringing it just in case. Like gas relief tablets, hairbrush, heating pad just in case, I don't know, and this travel size pillow because I'm thinking on the way out, getting pushed out, even on the car ride home, it'd probably be really nice to have this to lay on as I go back to the hotel. A long charger is really, really important when you're in the hospital so that your phone doesn't die, you know, have issues charging it. I hope that's it. I feel like I'm as prepared as I can be, so. Just got some relaxing medications put into my IV. So everything is good. And we're just waiting for Dr. K. He's pretty ready, I think so. Yeah, as far as we heard, he's ready to go. So I don't know if this is the last time you guys will hear from me or not, but
that's not a good sign.
We'll see.
It's gonna do great.
Yes.
This hospital so far has been amazing too, by the way. If you travel here, everything goes smoothly. I didn't have to wait that long for anything, especially as soon as I got here. So we're just pretty much getting right into it. I have an amazing nurse. Her name's Lizzie. She's awesome. Yeah, everyone here has been so nice. So I think Dr. K is going to be in here
Very soon.
Okay. I'm going to try to get a picture of him.
Yeah.
But yeah.
Awesome.
Good.
Yeah. It took a long time for my blood to come out, but I'm kind of used to that, so. Hello. My sister just told me I should stop because my music is playing too loud. Alright everybody, I'm literally about to go back any second now. I just saw Dr. K and it was amazing. He said a quick prayer with me before, so I feel so ready. Okay. Hi everybody, I didn't just wake up. I woke up a few hours ago, but surgery was like close to 5 hours long. I'm in my room now that I'm going to be staying in for the night, and the surgery was successful. I have so many pictures to see what it looked like in there, and he also took out my appendix because there was endometriosis on that, so I don't have an appendix anymore. And then cyst is removed, polyp removed, and all endos removed. My fallopian tubes looked good. Put the dye down them, and
no bowel resection.
No bowel resection. That's what I was like mainly worried about. I don't even know if I mentioned it in this video yet. There was a possible one because my biggest symptoms are IBS, but I didn't need to, so that's really, really good. I think for the rest of the night, I'm just gonna relax, rest. Yeah, we'll see, but peace out.
Okay.
It is now 9:45. When I woke up, I don't even remember what I said because I was on a pretty heavy drug, but my pain isn't that bad. I don't want to jinx it though because I know it'll probably get a little bit worse. I am honestly doing great. I ate a little bit. I had some chicken broth, Jello. It doesn't sound good together, but it was good. Crackers. And I'm trying to drink as much water as I can. I'm kind of having a hard time, but I think because, I'm not sure, but I think because I asked, or they offered me the morphine after I woke up. And so what had happened was I was really, really tense. Like I kept pointing my toes and like squeezing because I kind of felt like after surgery, like I had to go to the bathroom, but I also had a catheter in, so I technically didn't need to. And I told the nurse that, and she said, I can give you this medicine that'll like relax you. So I said, okay, and that didn't work. She checked on me like an hour after that. I said, no, it's not working. Like I'm still squeezing, and I'm afraid that I'm gonna like make myself feel more painful if I, I'm tense for like 2 hours straight. So she gave me morphine, and that automatically relaxed my body. And I think I'm still kind of getting off of it, and I think that's what's masking a lot of the pain. But of course, the nurses gave me my prescribed medicine that I'm supposed to be taking, like Toradol, Tylenol, things like that. I leave tomorrow morning, and my sister just left. She was with me for a really long time, so I told her like go home, or go back to the hotel and sleep because they only have a chair here too, and I don't want her to do that. I'm totally fine with staying here too by myself, so she left. But this is like my setup right now. Water, another water right here. Wait, where'd it go? Oh, another water, the soup that I had, and things like that. I got my AirPods, so gonna stay busy, probably watching videos or something. Probably gonna pray a little bit just to make sure that my pain, ask God to ease my pain tomorrow and the days to come as I fly home. So this is my room if you want to see it. Nothing special. Yeah. Hopefully I'll talk to you guys tomorrow morning. Good morning. I am in the hospital still. I had to stay overnight, so didn't get much sleep last night though because my pain increased. It's definitely increasing a little bit now that it's one day out of surgery, but we're trying to manage it. Can't breathe as well, but I'm trying to work on my breathing. I will be leaving today around 8, something like that, in the morning. So hopefully I do good at the hotel and I'm able to rest more because all I need is rest right now. I literally don't think that I've picked up the camera since the hospital, but I made it back to the hotel. We were there for another 2 nights, and now we are flying back home. I probably didn't pick up my camera because I couldn't really move around when I was at the hotel. The recovery, I definitely had my rough moments, but I stayed on top of my pain meds, and that helped tremendously. I also give it to God. I had a lot of people praying for me back at home, and obviously through my Instagram who reached out to me, and I really feel like that pulled me through. And I don't know, makes me so happy thinking about it. Just the love that we all have for each other. But so we're leaving the hotel, going on our flight, and I thought it would be way worse. I thought that I would be in horrible pain, that I wouldn't be able to sit on the plane or anything. But honestly, yes, I'm still healing, but I feel great. And it's just the craziest feeling. Even though my body has gone through this trauma and all the endometriosis was removed and all this stuff, everything that had to be gone. I can't even think straight. Everything that had to be taken out was taken out. So your body has gone through a lot of trauma, and that's what I'm feeling right now. But I can already tell a difference because all of that endo is out, and it's crazy. Hi! I've literally never been happier in my life. It's actually been a few days since I've gotten home from my whole surgery trip, and I just want to say that it has blown me away. I thought I would go home. I really thought I would go home in pain. I mean, I just got a major surgery done. And yeah, the pain meds have helped, but I was okay. I was better than okay. My spirits were so high. I'm not saying that recovery has been easy. I mean, of course, the first few days after surgery, I was definitely on and off in pain, but I was so wrong about how I would feel after surgery. And I'm glad I was wrong, because I don't usually have the best luck with surgeries or anything in general. I'll probably make another video on this, because it's a lot, but long story short, I am feeling and doing amazing. This was a major surgery. I mean, it's as complicated as brain surgery, they even say. A lot was removed from my body. Of course, my body's still healing. It's like that feeling, it's distended, it's trying to get used to everything that was taken out and it's swollen, things like that. But I feel the most amazing I have felt in years since dealing with endometriosis. Thank you guys for watching this video. I will definitely keep you updated on my recovery. I'll let you guys know in another video exactly everything that the doctor found and what it means, and you know, what it means for my quality of life and my future and my fertility. We'll see where we go from here, and I have very positive outlook on this whole experience, and all of the prayers and everyone who has been there for me has really gotten me through this. So thank you for watching, and I'll talk to you guys soon.